Welcome to the podcast that is about monitoring and evaluation in the COVID-19 responses. The Reference Centre has just released or developed a short set of materials with outputs, means of verification, and who should do the collection of the data. And we have asked Sarah Harrison, who's been the key author, to talk a bit about it. And later, I'm also going to talk to Koen van Praet from Belgium Red Cross Flanders, who will talk about the system that they have put in place for monitoring the well-being of the responders during COVID-19. So this is going to be a very interesting conversation. I'm Ea Suzanne Akasha, Technical Advisor from the Reference Centre for Psychosocial Support. Let me begin with you, Sarah. Would you introduce yourself briefly, please?
Yes, thank you, Ea, and thank you for the invitation. My name is Sarah Harrison. Similar to Ea, I am a technical advisor at the IFRC Reference Centre for Psychosocial Support. And in another functional job role I also co-chair a group of agencies that work on mental health and psychosocial support in emergency settings under the Interagency Standing Committee Reference Group.
And can I ask you to briefly introduce the new M&E tools for COVID-19 responses?
Yes, so a number of national societies have either rapidly scaled up or have had to adapt their usual programs and responses to the COVID-19 pandemic. And what we were asked to do, this originated mainly from the Asia Pacific region, but it's applicable to many national societies, is to help them document the types of work that they're doing. Some of this work is to be included in the appeals, emergency plan of actions, and the reporting that goes with an IFRC appeal. And some of it is also just for their own internal reporting within national societies and with their dialogue with their respective national governments. So we created a very short tool, it's about 4 or 5 pages long, that looks at the key areas that we know a vast majority of national societies are engaged in to some degree or another. So we chose hotlines and helplines as one intervention area. We chose phone counselling or psychotherapy session conducted over the telephone. We also looked at staff and volunteer care, and we also looked at trainings. Trainings usually being done in a remote format and on a variety of topics. And then what we did is for each of these program areas or interventions, we came up with what we call an outcome level indicator, and we came up with what's called an output level indicator, coupled with suggestions on how we think these indicators can be measured, and then who should collect the data later on. So, for example, very practically speaking, for a hotline or a helpline that many national societies are running, one output indicator might be whether the caller, the person that called in, whether the service they received was useful or helpful, did it meet their needs? And how can you assess this? We came up with suggestions to do a random sampling, so you could send a text message or an SMS message back to the callers that's randomly generated, and you could ask them to fill in a very short survey with some sample questions. And we came up with 3 or 4 very short questions. For example, was the service useful? Did it reduce your distress? Or did it give you positive ideas on how to cope with your challenges? And we suggest that for the surveys that they be filled in either with a number scale, so you pick a number between 1 to 5, for example, or using a smiley face scale if there are people with reduced literacy. So you could just respond almost like with an emoji response. And that could be collected electronically, particularly if you're using helpline software, which many national societies are doing. And it also helps managers, more program managers or volunteer leaders and managers of helplines to see whether the service they're providing, whether it's actually meeting the needs of the people phoning in as well. So we did output level indicators as well, some of which are much simpler actually than outcome level to measure. And for example, output level ones are looking at the number of people calling in, their gender, if they choose to disclose it, approximate age, the reasons for their call. So for example, it could be for information, it could be for a referral to another service, and also looking at informed consent registration as well. So we continued that for the 4 different areas that we came up with as being the most common areas that national societies are working in as well.
Thank you. That was really interesting and very extensive, and it must have taken a lot of consideration to make it so short and practical so that it can be applicable and be used in this very different type of situation where there's not much face-to-face interaction.
Yes, that's true. It is a practical tool. As I said, it's only the actual table with the kind of content of information is actually only 3 pages, and it's written in a table format, so it should be quite easy for volunteer managers, but also working in psychosocial support, but also PMER, Program Monitoring, Evaluation, Reporting delegates to also look at and see how it fits into their bigger programming and reporting within their national society. So the table format fits within a log frame and with the IFRC M&E template tools, and can also be used for national societies who might be using other monitoring approaches as well.
Brilliant, very good, thank you. And Koen, let me ask you, you are from the Belgium Red Cross Flanders, and would you introduce yourself, your position and what you're doing, and then talk us through what you have done in monitoring volunteer or frontline workers' well-being?
Okay, thank you. Thank you for inviting me. My name is Koen. I work at the Belgian Red Cross as a technical advisor. I'm a psychologist. I also have a private practice, and I do work a lot with people applying for international protection. At the Red Cross, we have done 3 things. We have on the basic level, the basic psychosocial support. We have chosen immediately to inform the public and to inform responders, 2 target groups, 1 way. By adapting the material from IFRC. Second thing is a crash course on COVID-19 with focused psychosocial support. It was basically a briefing to our own psychosocial responders that developed to a simple open e-learning, aiming at people involved in the psychosocial response. Of course, there was some basic info. We had DIY psychosocial intervention instructions, a self-care plan for people, and instructions for team leaders. But on the monitor level, we were puzzled. How could we monitor our volunteers if we have to stay on a distance? We had volunteers transporting COVID patients. We had trained Red Cross disaster response people that were kept as reserve troops, so they had to stay at home because we might have needed them for field hospitals. And we recruited thousands of crisis volunteers that had only an online e-learning. So how could we monitor all these people, not to forget those volunteers that lost their social activity, people at care libraries, people that are present at festivals, the normal Red Cross activities. So we built upon our existing measures. For example, we have a helpline for Red Cross responders. It's making use of our dispatching that is 24/7 open. If somebody is in need of has gone through something and is a Red Cross volunteer, they just can call that number and they are referred to a psychosocial trained volunteer. So we had this in place and it's known. We did proactive outreaching to those that got in touch with COVID patients. We opened a care page for volunteers, very simple, only a few pages. And then we started with a bi-weekly questionnaire. Based on the answers we get, we identify people we call and we offer a one-to-one talk over the telephone. So we try to connect, we try to identify people with needs. We try to monitor general needs and set up dedicated pages that targeting certain groups that had a special need.
So you were saying that there were questionnaires being sent out, there are the care pages, And the questionnaires, you said they were sent out. Were they sent out to each and every volunteer?
They were sent out, yeah, to each volunteer. We had an email address. Every volunteer in Belgium has its own Red Cross email address. So they all received the questionnaire, and we sent it also to our crisis volunteers. Those are new people, new to the Red Cross, specially recruited to assist in care centers for the elderly. Everybody receives a questionnaire, and this is a lesson we've learned from earlier crisis situations. People that cannot be active can feel really frustrated, can feel guilty, etc. So it's way easier to ask everybody's opinion and everybody how they're feeling, and not to focus on those that were active on the field.
The question is also to do with the survey or the questionnaire that you referred to. Is it a survey looking at staff and volunteer care? Is it looking at their well-being? And could you give an example of one of the questions?
Yeah, it's what you said. It's a very brief survey. This is a lessons learned from other surveys we developed in the past. Basically, there is 3 core questions. The question is to ask about their private life, and we just ask them, how do you feel in general compared to the last 2 weeks? And it just, the answer could be a lot worse, worse, similar, better, a lot better. And then the same question, how do you feel as a Red Cross volunteer compared to the last 2 weeks? So these are like twin questions. And we added a question that turned out to be quite important, and that is, did you consider quitting as a volunteer last week? Yes, more than once. Yes, once. No, no, I'm even more motivated. Apparently, this turned out to be quite handy, because how we decided who is in need, that is everybody who said a lot worse on one of the first 2 questions, or yes, I was thinking more than once about quitting as a volunteer. Those people got a phone call anyway. But we also decided to have an open question. So each question was followed by an open question, comments. Do you want to comment on your answer? That involves a lot of reading. We had more than 800 people answering the questionnaire. But it's very helpful to learn what is the mood of the people. Some people were frustrated because they couldn't do something, but other people were feeling guilty because they couldn't do something.
Yeah, thank you, Koen. I think it's a really practical example of how you've used a survey that goes out regularly to your volunteers, how you're using it for monitoring and staff and volunteer well-being perspective, but also how you're taking the lessons learned from the survey and changing or creating new tools or material for volunteers to help them as well. It's quite a nice active learning process you have going.
Thank you. Well, it was, we didn't see another way. We were very worried, and we didn't see another way given the circumstances. So this is innovation out of necessity, I would say.
But, and one very practical question, those that were doing the follow-up calls, who were they? Were they all staff from the headquarters, or was it also volunteers?
Yeah, no, from the beginning of the crisis, we have a strategy. When there is a really big crisis, we keep our psychosocial trained people as the experts, and we don't send them to the field too quickly, so they're in charge of looking after those that are in the field. So whereas when there is a smaller crisis, they would be in the reception center, but now we keep them for doing the support of our volunteers. So they have a psychosocial background training, and they went through the e-learning. Most of them are social workers or psychologists, but what they do is not, this is not how you call it? This is not therapy. This is just listening to somebody that is not feeling well, and they can be referred then to private practitioner if needed, but this is very, very, very seldom. Most of the people are quite happy to receive a phone call. They feel supported very well.
Very interesting. And also to sum up, would you say it would be fair to say that your main lessons learned are that you should include everybody in what you send out so everybody feels that they are included? You should make the M&E tools very simple, but there should also be open boxes for people to comment so that they can add any comment they may have about how they feel and on what they think and what they want to share. And the question about if they considered leaving the Red Cross was quite interesting and important for you. And finally, all this together allowed you to tailor more responses so that the volunteers' needs were taken care of as they evolved. Would it be fair to summarize it like this?
Yes, maybe to add something for people that make this service, you always end with a positive question. Huh? For example, what helped you that can inspire others? And people give the most nice and funny, but also deep answers that can inspire you as a responsible management level to share these messages or to adapt your response. Last time it was there a positive change? And a lot of people said, I was volunteering for the first time working with elderly. I was never expecting that this is something I like. Some people consider not going back to their jobs, for example. It's really nice to see how voluntary work can make people grow. And the open questions are really interesting to make that visible.
Thank you very much to Sarah Harrison from the Reference Centre for Psychosocial Support and to Koen van Praet from Belgium Red Cross Flanders for giving us this insight into monitoring and evaluation in the COVID-19. The new materials can be found on the PS Centre website, where you can also see the other materials that we have produced for psychosocial supporters in COVID-19.